And I rise to speak to the National Occupational Respiratory Disease Registry Bill 2023. This bill will create a legislative framework for the establishment and ongoing management of the National Occupational Respiratory Disease Registry. It's planned that this registry will capture and share data on the incidence of respiratory diseases thought to be occupationally caused or exacerbated, their causative agents, and exposures to those causative agents. The National Registry will also capture respiratory health data to aid in the detection of new and emerging threats to workers' respiratory health, to inform incidence trends, and to help with targeting and monitoring of the effectiveness of interventions and prevention strategies. Specifically, this registry will require respiratory and occupational physicians to notify diagnoses of occupationally caused silicosis. And it will also allow for the voluntary notification of other occupational respiratory diseases. It's anticipated that the voluntary notification of those other diseases, which are thought to be occupationally caused or exacerbated, will help with the identification of new and emerging occupational risks to workers' respiratory health. While silicosis will initially be the only disease for which notification will be mandatory, the bill does provide for other occupationally caused or exacerbated respiratory diseases to be prescribed, subsequent to further development by the Minister and the Chief Health Officers of the states and territories. This registry has been established to support the National Dust Disease Task Force in developing a national approach to the prevention, early identification, control and management of occupational dust diseases in Australia. It will help us identify disorders, occupations, job tasks and workplaces in which there may be a risk of exposure to respiratory disease-causing agents. It will provide the first-ever national overview on the prevalence and types of occupational respiratory diseases in Australia. That's great data to have. The register will enable preventative action to be taken to reduce further worker exposure, to assist with identification of suitable individuals for participation in clinical trials and observational studies, and it will facilitate research on the causes, the incidence, the prevalence, nature, extent and trends specifically of occupational respiratory diseases. Now, this bill comes in response to the significant number of stonemasons who have been exposed to the tiny particles of crystalline silica dust released every time they cut, grip and shaped engineered stones like Caesar stone into kitchen benchtops and bathroom vanities for the homes of Australia. One study into silicosis by Curtin University, commissioned by the ACTU, has estimated that as many as 275,000 Australian workers have been exposed to high levels of crystalline silica. Disturbingly, that union estimates that as many as 1 in 4 stonemasons working with engineered stone have developed silicosis. Mr. Speaker, this bill adds to the web of disease registries which aim to identify the incidence and prevalence of medical conditions in Australia, which track their epidemiological traits, follow their management, assess responses to treatment and identify patients for clinical trials. By improving the quality of our healthcare data, the existence of patient registries like this one should improve the government's ability to allocate our finite and precious healthcare dollar to best effect. There is a bigger issue, though, with this piece of legislation. It deals with a single respiratory disorder. There is no doubt that this condition, silicosis, is a tragic one. It is entirely worthy of scrutiny, and we should, as a country, do everything that we can do to prevent workers in their workplaces and to limit the risk and then improve the treatment of all occupational diseases. This registry is really important, given the significant prevalence of this severe industrial disease and its devastating impact on those people affected by it. But, Mr. Speaker, there are many life-threatening medical conditions. Just this morning I met with the Breast Cancer Network of Australia to hear their call for improvements to the collection and reporting of metastatic breast cancer in this country. A worthy cause, and one which is worthy of support. I've just come down from meeting with representatives of the diffuse intrinsic pontine glioma community. They're in the House as we speak. DIPG is a relatively rare disorder of early childhood, but 25 Australian children die every year from the complications of DIPG. We don't have a national registry for DIPG. Australian children are enrolled in the American registry, and our oncologists, our cancer specialists in this country, keep track of their patients themselves. But DIPG has not been subjected or has not received the same amount of attention or support as silicosis. It's not a lottery, but nor is it fair. Next week, I will meet in this House with representatives of the Children's Tumour Foundation, who represent patients and families affected by another rare disease, neurofibromatosis, 1 in 3,000 people, rare but often severe, and also worthy of research and of support. Separately, next week in this House, I and my colleague from Macarthur, the member for Macarthur, will meet with representatives from Spinal Muscular Atrophy Australia, another severe, devastating disease associated with high mortality, again worthy of support. We will also meet with representatives of the community affected by Duchenne muscular dystrophy, another rare disease, 1 in 5,000 boys, devastating, severe. All of those representatives from these various communities are advocating for better quality data collection to facilitate improved care and research into these diseases. In my previous professional life, when I was Director of the Neurology Department of the Royal Children's Hospital in Melbourne and Head of the Australian Neuromuscular Network, I established the Australian Neuromuscular Diseases Registry. Neuromuscular diseases affect 1 in 1,000 people in Australia. They are relatively common, cumulatively. They are severe and they're often life-threatening. My colleagues and I established that registry so that we could better understand the history of those disorders and how to monitor and treat them, how to improve our service provision, how to identify subjects for clinical trials and how to bring those clinical trials to Australia. That registry, which is now up and going, it's been going for 3 years now, represents a platform for patients, for clinicians, for researchers and industry to work together to develop new therapies and to advance scientific knowledge of those rare diseases. It was funded by the government? No. It was funded by pharma and by donations from patient groups and support groups. It had no government funding at inception, and it has had no government funding since. Australia has a comparative advantage in our potential for data collection, which puts us in an exceptional position to set up registries like that which is under discussion today, and like the registry that I established in 2020. They can be established as an extension to our world-class universal healthcare system, Medicare. We should be able to collect the data that we will collect as a result of this bill we're debating today much more efficiently, effectively and cheaply. It is wasteful and it is inefficient to be reinventing the wheel for every one of the thousands of serious diseases that our medical professionals see and manage. Healthcare data collection in this country has been problematic for a long time. It's piecemeal and it's patchy. The government must look to improving the quality of our data collection on this and other rare diseases. It should look to making the best of the Medicare system and the data that it collects. We're not doing that in a way which is intelligent, which is forward-thinking, and which is going to optimise the healthcare provision in this country. And so, although I am very happy to support this bill, and I support the government's efforts in increasing and improving support for patients affected by occupational respiratory diseases, I also ask this government to show the vision that it needs to show to approach our Medicare system, the data collection within that in a more holistic fashion, to look at better collating and assessing the manifold data that our medical professionals are collecting now, to putting together the many hundreds of individual disease registries that medical professionals in this country have already established, and to giving us a vision for how healthcare, medical research and the nexus between the two of those can be improved in the future. I commend this bill to the House.